fourth Saturday of the month, and of course each and every fourth Saturday of the month, it's Footsteps for Life, brought to you by Dr. Tanisha Richmond and the Richmond Foot and Ankle Clinic, located conveniently inside of the Dr. Charles R. Drew Health Center. That is 1323 West 3rd Street, and of course that's West Dr. Martin Luther King Jr. Way, West Dr. Martin Luther King Jr. Way, Dayton, Ohio, 45402. You need to reach Dr. Richmond. You can give her a call at 937-228-3668. Dr. Richmond, we had an interesting conversation during the break. And, this is of course, it's no secret that in the city of Dayton, particularly Montgomery County, we've had some real issues with the opioid epidemic.
Yes.
And even some conversations and some legislation that's taken place with medical marijuana.
Mm-hmm.
Let's talk about marijuana for a minute. Where are we with that? And how does that affect, and how does it leverage out with the pain clinics?
Well, medical marijuana is now legal in the state of Ohio. However, you must see a physician who is certified to give you the medical marijuana card, and then you have to go to a medical marijuana store and purchase it. Now, if you are on narcotics or if you're in a pain management clinic, you first need to discuss that with your pain management physician or your primary care physician. It's really a discussion you have to have with them to make the decision whether or not they're okay with you taking the marijuana, because marijuana can interact with other medications that you may be on. So it's not just the free-for-all. You still need to talk to your primary care doctor, or if you're in pain management, you have to discuss that with them and let them give you that approval, because the medications that they are prescribing, there's so many drug interactions and side effects. They need to be comfortable with you taking the marijuana, or at least be aware that you're doing marijuana for pain.
Now, those that are taking or being prescribed the medical marijuana, is it the actual marijuana or edibles, or both?
Both. I think it's both. I think there's edibles because they have it in a liquid form and they put it in different things. And a lot of patients have asked, well, why can't I just buy it off the street? Well, you don't know what's coming off the street.
Right.
This is mandated. It's being followed by the state. It's being monitored and supervised by the state. So they know exactly what's in these products, versus that's kind of what's happened with our heroin epidemic. People were buying heroin from their regular drug dealer, and then their regular drug dealers started cutting it with fentanyl. But their regular drug dealer is not a pharmacist or a chemist. So they were killing their clients because they were giving them too much fentanyl, or they were giving them pure fentanyl, or however else they were mixing these drugs. But there was no, this is something that's being done in someone's kitchen. So people were dying left and right because they were getting drugs off the street. So it's something that, like Dr. Morar was mentioning before the break, I think it's a good option for pain management. Anything that's natural that won't kill you. No one has yet to overdose on marijuana except for edibles. Someone did do that, but they ate too many of them.
They love those gummy bears.
Yes, they ate the edibles, but they didn't die. I think they went to the ER and they were treated. But I think it's an option. I mean, Montgomery County, I don't think we're number one anymore in the country for overdoses, but we were number one for a while. So I know the coroner had so many bodies, they had to buy cooling trucks to put the bodies out back.
Amazing.
Because people were dying so badly and so quickly. But I think it's something that's a good alternative to our current pain management and pain or addiction issues. So I hope it works, but I think it's a good natural alternative for pain management. Let me pass this on to Dr. Morar.
Speak to us, Dr. Morar. Let's talk about marijuana.
Yeah, no, I would completely agree. We have a very large pain practice. A lot of our procedures, these minimally invasive procedures, we are offering to our patients, from injections to nerve blocks to nerve ablations. We even fix back fractures in the same way, using our X-ray cameras, using little needles, and what happens is most patients are not usually surgical candidates, meaning not everybody can get back surgery, and there's a rational fear of back surgery because it's a hard diagnosis for back pain. There's a lot of things that in this day and age we have a very firm grasp of why you're having this problem. If you got a blockage in the artery in the leg, it's a no-brainer. It's easy to figure it out. But back pain's it's complicated. So what happens is the cause for the back pain is hard for us as doctors to always know. And this is why, for back surgery, maybe the success rate isn't as good as a knee replacement. It's not 90%. It's like 50, 60%. And this is why, for good reasons, patients are scared to have back surgery. And this is why there's so many alternatives for pain and spine problems. This is why we have chiropractors and massage therapy and acupuncturists. And, this is why a big part of my practice, there's these procedures that we can offer to help. And so what happens is a lot of these patients kind of get to the end of their rope. And we as doctors don't know what else to do as far as fixing the underlying problem. So what happens is we've been pushing these patients to opioid type pain clinics. And so we haven't really had a really good alternative as far as medical management other than opioids until now. Mm-hmm. So I'm very excited about what medical marijuana is going to do for our community as from the perspective that, hey, if we can, if that can help us wean these patients off of the opioids, it's like Dr. Richmond said, nobody dies from marijuana, but we know for sure people are dying from the opioids. And so it fits really well into this larger problem in our society of the pain issue. And then on top of that, from a regulatory perspective, what's happened is the state medical boards and pharmacy boards have now created such a restriction for who can even prescribe the opioids. So a lot of patients have severe pain issues, and most doctors can't prescribe. Your family doctors can't prescribe pain medicine anymore because it's highly regulated. So we only have a handful of docs in town that are even certified or that have the licensure to write these heavy narcotics. So what does a pain patient do? They go to the street, they start using, synthetic fentanyl and heroin. And this is really where things are starting. It's that patients have pain, legitimate pain. We can't always figure out why they're having the pain, and there's not a good alternative. And now they can't, it's the patients who are even getting who need the opioids can't even get them. So
for individuals that may need the medical marijuana, what would be some of the medical concerns or issues that they would have that would warrant them to be able to prescribe that? So
the main indication is chronic pain. There's definitely a clear role for patients with chronic pain issues. Patients who have failed other treatment options. Mm-hmm. Patients, there's a syndrome called failed back syndrome. Patients who had surgery that has residual pain. So what happens with spine surgery is that a lot of times the original pain never goes away, or because it's such a small part of the body to operate on, you get scar tissue that then causes new pain. And so a lot of these poor folks will have this chronic pain, and then they'll go through a round of narcotics. And, in my experience, I think there's the huge societal misconception on drug seeking. Most of my patients don't want to be taking drugs. They're not drug seekers. I don't believe that human nature is inherently structured that way.
Well, I hear some of the side effects, and you can speak to this, Doc, concerning, constipation. A lot of people that take pain meds talk about constipation and other side effects that are really bad.
Yeah, most of my patients don't like to feel loopy. They don't want to feel high, so to speak. Mm-hmm. They just want to be able to be functional, and a lot of the opioids don't allow you to function in a normal job. And so they're begging for ways to not have to take opioids, but we just don't have a lot of great options. And so I'm hoping the medical marijuana piece plays a vital role, and we're kind of hoping that the regulatory powers that be, are going to let this grow.
Okay. Have you seen a lot of prescriptions being prescribed to different individuals for medical marijuana?
It is still very early in the game. Very few patients know about this. There's very few clinics and very few doctors still that are, and then the big hurdle is that it's not covered by insurance, right? So there's a out-of-pocket cost. And having said that, it's probably the last 6 months is when we really started sending patients to these clinics. But having said that, I haven't had one patient so far who isn't interested.
Yes.
And I like to use the term THC clinic instead of marijuana clinic, so that I don't want people to think that they're having to take a drug to make their pain go away, and that stigmata may take a while for it to really go away.
Interesting. So let's shift a little bit and talk about the feet. And we've had great conversation. I love it because we've been all over the page, but this gives individuals a chance to really grasp some information that may help them along the way. First of all, your Thursday's free evaluation, I understand, is just going extremely well. Can you talk a little bit about that?
So, on Thursdays, you can get a free vascular evaluation. It's offered every Thursday. So basically it's a screening. They can schedule an appointment by calling 937-228-3668. We go through a screening, ask some questions, come in and do a short exam for the patient. If it's determined that they need the vascular study, which is the ABI that we talked about, then we'll get them scheduled. If there's time permits, it may be done the same day. But it just depends on scheduling. As far as if you think you have this issue, it's always easier just to have a screening. Like Dr. Marard talks about, this is all preventative. This is all preventative care. There's no, I always say, there's no direct go to amputations like a monopoly. It's a step. It's a stepwise process. And our goal is to come in there and stop the steps, to come in there and intervene and fix, like he said, like he's the plumber. I'm the person that gets him to the plumber. So it's a minimally invasive screening.
That's awesome, how you two work together, and I think it's just great. Now, for our listeners that have a couple of questions about the CBD oil, where do you stand with that?
Well, the CBD oil is, I'm thinking it's going through legislation to be, it's legal on the federal level, but it's not legal on the state level yet. I think they're actually talking about getting that through. So it is illegal as far as I know on the state level. However, it's being sold at gas stations and all these other places. I actually went to a conference in Columbus a month or two ago. They said if you are caught with CBD oil and you do not have a marijuana card, you can be charged. I don't know what charge that may be, but I know there's been cases. Actually, a lady was arrested at Disney World in Florida. I think she came from South Carolina. CBD oil is legal in South Carolina, but it's not legal in Florida. And they searched her at Disney World and arrested her.
Wow.
So they're saying, like, if you're traveling and you don't know, you need to know the laws of the state you're going to, because it may be legal in Texas, but it's not legal in Oregon. So the laws don't apply when you cross state lines, or if you're flying, the laws, especially going out the country. And especially because I traveled to Denver, and going through TSA, it was a couple hours.
Wow. Because
they're checking you for marijuana because you're leaving and crossing state lines, and they're worried about you crossing state lines with marijuana. So you just have to know your laws. A lot of information should be at the Ohio State Medical Board and the Pharmacy Board, and it will also list the physicians who have the specialty to give you the marijuana screening, to get you the cards, and then it should also have a list of the actual stores that are open. I think they just opened one up in Springfield recently. But all that's online. I would check the Pharmacy Board.
Okay. Any additions to that, Dr.
I think
Moore?
those are perfect. Good summary.
Okay, great. So as we begin to wrap up, I know there may be some things you may want to expound on, but before you get to your wrap up today, can you share with us about your foot spa and your foot boutique and all the wonderful things that you sell in your store?
Okay, so we have a foot boutique where we sell like diabetic socks, medicated toenail polish. We have all kind of hammer toe pads and bunion pads. We sell pumice stones to use on your calluses, especially for my diabetics and high-risk feet. And then we also offer a therapeutic foot spa on site. So it's non-invasive. It's in a private room done by the medical assistants. Your feet are scrubbed with pumice stone scrub, massaged, and then I will come in or another physician will come in and do your nails and calluses. So it's nothing sharp done by non-medical people. And most patients do that. They'll come in sometimes outside of their appointments, but most patients schedule it before their appointment, get pampered, and then I come in and take care of the rest.
That's awesome. And you provide so much at your foot and ankle clinic, Dr. Richmond. Hats off to you. They can also, if they're an established patient, they can make an appointment online.
Yes, they can go to richfeet.org and schedule. I think they click the schedule an appointment tab. So it's for existing patients only. New patients, you got to call to get an appointment. So you can always go online any time of the day. I think they now can schedule through my Google, or they can send messages through Google, my Google search. So if you need things, and then also if you also sign up for the patient portal as a patient, you can send messages and do requests through the patient portal site as well.
And they can of course find you on Facebook and LinkedIn.
Facebook, Twitter, LinkedIn, Instagram, occasionally Snapchat. Or IG as they call it. They don't call it Instagram anymore.
IG, that's right.
IG.
The millennials will correct you every time.
Yes, it's IG now. So I'm all over the place. I do have a new commercial coming out. It will be running on 22 and 45 probably next week. So you have to look out for that.
All right, TV commercials coming. But of course, you've got radio every fourth Saturday of the month, and I can't believe we're going into August. It's just really amazing. So you will be back with us on August the 24th.
Oh, okay.
August the 24th. That would be our fourth Saturday of the month. Any final words, Dr. Mora?
No, I just appreciate the opportunity. If you want to learn more about the vascular stuff, visit ampustop.com. There's a lot of good information there.
Okay, thank you both so much. Dr. Richmond, final words.
Take care of your feet. You only have two.
All right, you heard it. She's been telling you that for years now, so you got to take care of your feet. You can reach Dr. Richmond at 937-228-3668, and of course she's located at 1323 West Dr. Martin Luther King Jr. Way. That is, of course, inside